Suffer from stress as much as adults do. To express themselves, they will misbehave and use attention-seeking behavior, which may easily be overlooked. To tell us more, we are now joined by JoannaKleovoulou, a clinical psychologist and director from the psychmatters Family Therapy Center. Joanna, good morning to you.
Thank you for having me on your show.
No, thank you for joining us. Please just say your surname for me.
Kleovoulou.
Kleovoulou. Kleovoulou.
Kleovoulou, like Clever Zulu.
Kleovoulou. Thank you for joining us this morning. First, just describe stress. What is stress?
Before we even begin to describe what stress is, we often think about childhood in the eyes of parents and adults, synonymous with playfulness, carefreeness, and being happy.
Yeah.
So we tend to then overlook the problem and even minimize what our children are experiencing. So stress is seen as a physiological as well as a psychological interpretation and manifestation of new experiences, often involving change and demands that are placed on us and the demands that we place on ourselves.
Okay.
So it's always to put those two aspects into consideration.
Okay, so it's demands that are placed on us and demands we place on ourselves.
Absolutely, and how we interpret the situation.
Yeah.
So it's internal as well as external demands that we experience, and then there's a whole lot of physiological responses that take place within our minds and in our bodies, and then that's the output is how we cope.
Does it mean that we are saying we can't cope? Are we showing perhaps an internal reaction that says we are worried whether we can deal with this or not?
Absolutely not. Stress is actually quite an important part of our makeup.
Okay.
We need stress, a bit of stress to motivate us, to keep us busy, to keep us occupied and to fuel our energies.
Yeah.
So we do need a bit of stress.
Okay.
But when you find that the stress becomes overwhelming for you and you're unable to cope, and it's becoming a dysfunction in your work, in your family and social environment, then you know you need to seek help, and that's when it becomes a problem.
Okay, so the assertion here is that children suffer from stress in the same way that adults do.
Absolutely. It's very difficult to find statistics in South Africa, but a recent study that was done in the UK over 40 years have picked up that 70%, there's been an increase of childhood mental illnesses by 70% in the last 40 years.
Yeah.
I'm seeing it in my practice as well, children coming for separation anxiety, enuresis, which is bedwetting, trichotillomania, hair pulling, and depression. And these are often symptoms of children and parents not being able to cope with what life is handing them.
Yeah. For the kids, is it mainly stress arising from what they are feeling internally, or is it out of the more external kind of environment they have to confront on a daily basis?
It's both.
Yeah.
You often find that children that have parents that are perfectionistic and want, push their children to the extreme, that kind of not really listening to what their child has to say, that there's not a safe environment for children to feel heard and understood.
Yeah.
Often those children then struggle because of what they're experiencing in their home environment. And then you go into a school environment where you have to compete for your space. You've got to compete to be the best. We often hear that, if you don't do well at school, you're not going to have a place in the job market. So it's all these external factors that children have to contend with. And children also, we need to remember, are super sensitive to what they hear in the environment, because that's where they're learning all the time.
Yeah.
So when they hear that parents are struggling financially, when they hear that their friends' parents have been held up, or there's been a robbery and a hijacking, high incidences of crime, major disasters worldwide, they've got access to information.
Yeah.
So the internet, the news, and then they're
cell phones.
Absolutely. So they're not quite sure how to monitor and what to discard and what to internalize as valuable information.
Is there an age at which children are immune from these stresses, where just being a child is being a child, and whatever is happening around you, it just doesn't come at you? Is there a sort of a threshold? So from about 6 years old or 7 years old, it's a different kind of ballgame.
Well, we try, and as whether we're therapists or parents or adults, we need to try and provide the most productive growing ground for our children to learn and to adapt. So we don't want to exclude them from any kind of stress. We don't want to overprotect them, because then they won't be able to cope with challenging situations. But I often say that around the age of 7 and 8, if we've provided our children with a strong, consistent place of safety and a good growing ground, then they have the ability to then cope with whatever life has to offer them.
Okay, you're a parent. you are noticing some things. You're not sure whether it's stress related or not. What are you seeing? What are the indicators that parents should be looking out for?
It's very important to be able to be aware of what the signs and symptoms are. So some of the things to look out for are often children don't have the words to vocalize what they may be experiencing. So it often is manifested in their bodies. So they often tell mums and dads, I have a tummy ache, I have a headache, and there's often no medical explanation to confirm what this child is experiencing. Often sleep disturbances, so nightmares, grinding of their teeth, sleep talking, sleepwalking, loss of concentration at school, not being able to focus, inattentiveness. Those are often markers. Eczema is often a good indicator, and hair loss.
Okay.
And then you also have the psychological impact, which is often acting out, clinginess, crying, whininess, withdrawing from friends, feeling not motivated to do things.
But if you see it once or twice or 3 times, don't just panic. You must see a pattern. You must observe it over time.
Absolutely. When it's persistent, and it's when it's impacting on the child's ability to function in the child's life, which is at home and at school and with friends. Which is, we say, between the period of 2 weeks to a month.
And what would you recommend? Have a conversation with the child, immediately go to a therapist. What is the best way to deal with it?
Again, to provide a space for your child to come and communicate with you, or to observe what the child may be experiencing. And then to allow the child to tell you how the child is feeling. And then if you're finding that is not helping, and that is whatever you've done to address this with your child, to then seek professional help.
Okay, I want to show you a picture on the front page of the Star. Look at that little boy there. He's really just battling not to get into class. And I think for many parents, this may have been what they went through yesterday and on other days. I mean, if you're a parent and this is what has happened, or some of it, your son or your daughter came out of class, ran after you and that kind of thing. If after 2 days or 3 days they don't settle down, then you need to begin to worry.
Absolutely. And I mean, it seems to me this child is very young. And it seems like he's being a bit oppositional about not wanting to go to school. And we often then want to punish the child and, set, very strict rules. But there might be something more profound happening for this child. He might be afraid. He might be afraid that his parents are not coping at home. He might be afraid that it's not a safe environment at school.
Or it's a massive change. I mean, they've been at home for a long time. Now they're going into this new environment. It's
unpredictable.
Structure. You don't know what to expect almost.
Absolutely.
Okay. All right. Well, thank you very much for joining us. So just somebody listening to our conversation, contact details if they'd like to reach you.
Sure, 011 450 3576, and we have a website as well, should they want to contact us.
What's the website address?
www.psychmatters.co.za.
Psychmatters.co.za.
PSY.
Okay, there's the business card there. You can see all of the numbers. Thank